Go.
Good morning. I'm Dr. Shamli Singhal. I'm a surgical oncologist and the founder of Hope and Beauty. I'd like to welcome you all this morning for coming out to join us to talk a little bit about self-care and to spend a little time thinking about how we can do better for ourselves. And especially in the times that we have, it's really important that we spend a moment worrying about ourselves instead of everyone else for just an hour or so. So I'd like to introduce my colleagues, and maybe I'll just let them introduce themselves really quickly, and then we'll get started. So Becky, you want to start?
Yes. Hi, everyone. I'm Becky Keene, and I'm the founder, owner of Oncology Spa Solutions.
Hey, Brooke.
Hi, my name is Brooke Devlin, and I am the owner of Brooke Christina Skincare.
Hi, my name is Julie Bach. I'm the executive director for the nonprofit Wellness for Cancer.
Great. Okay, so as I said, welcome, and I'll have the next slide, please. So a lot of people have asked me, well, why, you're a surgical oncologist, why is it that you've decided to take on some of these things that happen to patients? And I'll just tell you a couple of quick stories, because I think there's a big difference really between how we treat disease and how people perceive their illnesses and perceive things. And so I want to tell you a little bit about Brigitte. Brigitte had cancer about 5 years ago, and Brigette's occupation, she's a stylist, she's always beautifully dressed, always her makeup is perfect. And she said, when I was going through cancer treatment, I just didn't feel well. I didn't feel pretty. I didn't feel like myself. And when I looked in the mirror, there was this woman in the mirror that didn't look like me. And I just didn't feel about myself the way I needed to feel. And there were all these little things that happened. So my nails cracked, my skin got dry, my hair fell out, and no one had any explanations. And so she said she went to all different places looking for solutions, and there were no answers to her questions. So I'll take the next slide, please. And she wanted to be pretty. She wanted to feel pretty because that was such an important part about it. And, I think that all of us have that element in us, that how we look really impacts how we feel. And there's a lot written on body image, and there's a lot written on a lot of things regarding that. But if you look at cancer patients in particular, and you look at what contributes to people's sense of well-being and their quality of life, it's really how they look and how they feel in the mirror. So some of the things that we're going to talk about today, while they seem like potentially they might be luxuries, but they're actually really contributing to the sense of well-being. And that sense of well-being will carry you forward. Next slide. And what I like to say to people is that if we can deal with a few of these little things that help you to feel better, then I think that the big things of going to find your scan results, going to get another test, worrying every day about recurrence, those things become just a little bit easier because you're just a little bit stronger. The little things do add up to this. Everybody tells these cancer patients and tells everybody, just keep a positive mental attitude, just be positive. Okay, but what does that mean? How do you do that? And a lot of it has to do with just managing the things that are natural to you. So taking a little time for yourself, making sure that, if having perfect nails is the thing that makes you feel like you're well, great, do that. And just taking that minute to invest in yourself. So next slide. I'm going to talk a little bit about chemotherapy and some of the things, because I think what I've noticed and what the patients come to me is that they don't bring up some of these little topics. And what you don't realize is that you take chemotherapy and it affects all of your body. So next slide. So what is the mechanism? I'm going to put my glasses on so I can see this slightly better. But the mechanism of chemotherapy is, and when we talk about chemotherapy, what the idea is that you have to treat the cancer cells and not injure the cells that you that are your normal cells. And so the mechanism of chemotherapy really is dedicated towards the actively dividing cells. So when you have side effects, it's because there's an overlap between what the medication does and on your normal cells. For example, if you take Taxol, you take cisplatin, you take any of these drugs that really affect rapidly dividing cells, some of the overlap is going to be on your own rapidly dividing cells, your skin mucosa, your mouth, your GI tract. Those are the things that get affected pretty heavily when that happens. Next slide. And then there's another medication, which is the anti-estrogens, anti-hormonal. So people are very familiar with them. Tamoxifen, raloxifene, exemestane, aromatase inhibitors, all of those things. And some of the men get anti-androgens and things like that. And what that does is it blocks the ability of a cell to respond in a number of different ways to hormones. And when you do that, if you imagine that menopause and all of these things that happen as we age, our ability to respond to hormones changes. And so if you get tamoxifen kind of early, you get all the symptoms of menopause. So you get hot flashes, you gain weight, you retain water, all of these things that were sort of unexpected, right? And then in addition to that, the medication itself can lead to its own set of side effects. So next slide. I'm going to take Taxol because Taxol is a very common medication, and lots and lots of people get Taxol for one thing or the other. It's a medication that affects a lot of solid tumors and can treat lots of solid tumors. So on there is a laundry list of different things that it can do, but I'm going to focus on a couple of things that people really are bothered by that isn't really clear when they give you the package insert, okay? The medication has some strong side effects, which are, maybe it's nausea, maybe your hair falls out, maybe you get neuropathy. But the little stuff is that your skin gets very dry, and the nails that you have, they get black, they crack, they're very painful, and then they lift off in this very strange way that leads to your inability to button your clothes. You can no longer tie your shoelaces. And that, in addition to the peripheral neuropathy that Taxol has, can really be debilitating to your life. So this is where I would say, we treat the disease, and we'll treat your disease with Taxol, but the illness is the impact to you of all of this treatment. And we have to address both. And if you can't button your clothes and you have to wear pullovers all the time because you can't button your clothes or pull up pants, that's a big impact to your life. I mean, it sounds like a trivial one, but it affects your day every single day. And it affects your choices, and it affects the way that you interact with the world. So maybe taking care of that would be an okay place to start. Okay, next slide. So once you start treatment, what we talk about is your skin changes once you start treatment, and it changes in a way that you may not predict. And your skin it falls in this category of compromised skin. And compromised skin really means that the medication you got has fundamentally changed the skin that you have. And you have to look at ingredients, and that's why we have a section on ingredients. And you don't want to injure the skin any more than you have. The second thing is you really would like to make sure that the breaks and the cracks in your skin don't progress, and that you have to do things that will support and nurture and take care of the skin in that way, and not be any harsh chemicals, not be any things that would injure the skin further. And then the last thing is to think that the products that you have before you came into treatment may not be good for you right now, because you're in a different place and your skin's kind of in a different place, and you may have to rethink those product choices. And the last thing I would just say, and I think I probably talk about it later too, is that your skin becomes very sensitive to the sun. And that is something that people don't really tell you. And that sensitivity to the sun leads to impacts very heavy impacts. You sunburn much easily. You really have a lot of trouble with managing how you are outdoors. Next slide. So what's the function of the skin? And we talk about the function of the skin in terms of the different layers of the skin. And when a physician thinks about the skin, we don't think about it too much in terms of how much skin there is and how compromised skin can change the way that you're hydrated, a crack in the skin, and there's a barrier function to the skin, which I think is really important for people to understand, is that when the barrier is now disrupted, then there's lots of places and lots of micro cracks and all different places where infection can get in, dryness can get in, it can be painful. And remember, within the skin is embedded immune cells, pigment cells, all of this thing. And the skin is the largest organ in the body because if you compare it to the size of a kidney, it's substantially bigger. And there's just a lot of it everywhere that needs to be managed. So I'll take the next slide. Okay. So I'm going to move my glasses a little bit since I can't see the slide. So this is what I was saying about damaged skin, is that when you damage the barrier function of the skin, what you allow for is you allow things to get into the skin that don't need to be in the skin, and you also then can let the water out. And when you let the water out, the skin gets drier, and then you lead to this eternal cycle of cracks. And then the cracks lead to more dryness because there's more exit for the skin, the water from the skin. And those are the things that we're really going to emphasize in this class, because you don't want to set up a vicious cycle in the skin, and make sure that your products and everything like that are really, during the treatment phase, designed to retain the moisture in the skin. Next slide. So when you have the chemotherapy, the things that happen, which, you know, most patients when they start chemotherapy are so concerned right at the front of, oh, well, what if I lose my hair, right? And they don't really necessarily think, well, my scalp is going to be dry, my skin is going to be dry, it's going to be red, and then all of a sudden I have this burning in my fingers that I can't manage, and then my fingers are much more sensitive, and then they crack the nails, and then all of a sudden the things that I knew how to do are just not really available to me. So I put on the side just a number of different things, and I'll only highlight for you this thing that happens to people called hand-foot syndrome. And what hand-foot syndrome is there's a couple of medications that preferentially affect your hands, and they cause severe dryness, and it's almost like you get chilblains on your fingers, and the skin cracks, the nails crack, and then the fingers, it's so painful that it's like you've got sharp shooting pains in your fingers. And that comes as a surprise to people. I mean, we tell people, oh, you know, this might happen, but when it actually happens and you can't hold a cup in your hand, then all of a sudden it becomes something that is the major focus of your day. You can't have a cup of coffee without putting a little sock around the coffee cup so that you can hold it. Okay, next slide. So let's talk about the different kinds of moisturizers. And this is just really basic information so that you can have a sense of what we're talking about when we talk about different moisturizers. So, and probably the estheticians are way better at talking about this than me, but I will just put it into four little categories. And one of them is an emollient. And these are things like Vaseline, Aquaphor. We don't recommend Vaseline as such, but it's that kind of greasy coating that will keep the barrier function. Shea butter falls in that category, but the sensation to people is that they're kind of greasy. Humectant means that they're water compounds that keep the moisture in the skin. So hyaluronic acid, glycerin, honey, you know, there's a lot of different ones, but the idea is that you just try to trap the moisture in the skin. Next slide. They're anti-irritants. So things like oatmeal, calendula is another good one, where it sort of quiets the skin, soothes the skin. And then there are other compounds like ceramides, which kind of get in between the fatty parts of the dermis and bring in the moisture and hold on to the moisture. So next slide. So how and this is just really practical stuff. Okay, how do you deal with dry skin? Now, many of us think of dry skin, and when you think about dry skin, what you see on your skin is you see this kind of whitishness, flaking, and then cracking. And the tips that we have really have to do with simple stuff that you can do. You take lukewarm showers, not hot. Avoid scrubbing the skin. Stay away from the fragrances and fragrances that target, and you can use a humidifier. And then instead of wearing tight clothes that rub against the skin and can irritate the skin, you might wear loose clothes. Now, when we talk about grading, this is the medical side of things. Like, you know, dry skin is sort of a subjective sensation, but the dry skin grading from is that, you know, they talk about mild, moderate, and severe. And when you look at your body, you're trying to tell, well, what is 10% of my body, right? I don't know what 10%, does it mean my arm? Does it mean what? So when we look at percentages, we calculate, you know, the size of your palm. So the size of your palm is supposed to be about 1% of your body. So if you've got dry skin that adds up to 10 times your palm size, then that's 10%. So it's just a quick and dirty way of thinking about how much do you have dry skin. And that's the dry skin section. Next slide. This is what I was talking about, photosensitivity. The drugs that people get, often that they get, are sit inside the skin, and they sit inside the skin, and when the sun shines on them, they cause sensitivity, and they cause people to feel that they get red really quickly, that they burn very quickly, and one has to be really cognizant of it because it happens while you're taking chemotherapy, and then it may change the way your skin responds to the sun for your whole life. And that everyone will also tell you is that the best way not to get a sunburn is not to go in the sun, right? That's easy, but it's not practical. So hats, those big floppy hats are important. They're sun-sensitive clothing. And then there's sunscreen. And we can talk all day about different sunscreens, but at the end of the day, probably it's mineral sunscreen that is better for you. Next slide. Radiation in the skin. What happens with radiation? Radiation, and I think there was one question about radiation and the skin. Mm-hmm. We have different areas that get radiated, and there's different consequences to them. One of them is on the breast tissue, on the breast and the chest wall, and it gets red, it gets dry, and then it gets painful, and the skin starts to lift off, and it's sort of graded like sunburn. And there are things that you can do. There's a few different clinical trials that talk about those products, and calendula and calendula-based creams are really the ones that are the first line of defense against radiation damage to the skin. Then the next line of defense would be something that contains a cortisone to cool down the inflammation. And more recently, there's a barrier cream which is available by prescription called Episerum, which has non-toxic ingredients and all of that. And that, at least in my experience, has been by far and away the best offering in terms of keeping the skin moist and barrier. And most people, it heals the skin, as you know, you put it on twice a day, and the healing is really quite remarkable with that prescription strength. And not everybody needs, to be fair, not everybody needs prescription strength to get through this. Really, it's just about noticing that the dryness and the radiation is going to come and build up. And so the earlier you take care of it, the better off that you're going to be. Okay, next slide. Now, hyperpigmentation, and we talk about this in a couple of different ways. And so this lady on the left is actually one of my patients, and her face has all these brown spots on it. All of a sudden, she started taking aromatase inhibitor, And she ended up with brown spots almost everywhere. You can look at it on her fingers, on her face, but again, when she looks in the mirror, she doesn't recognize the person that's there. When we talk about hyperpigmentation, once you're through treatment is when we would start dealing with some of these things. And there are solutions to it. It's just while you're under treatment, we're all in the restore, calm place, and then move on to treating hyperpigmentation when it happens sort of later. Next slide. So this is so I just gave you a little bit of an overview of the kinds of things that happen to people's skin. And what we're going to do next, next slide, I think, is if you have questions, this is a list of products that you may need. And I think that later on, the detail about the products will be from our estheticians. And so I think that's probably more detailed information. Next slide. We have a wellness box, and we'll talk about it later. And these are products that have been used by our oncology-specific estheticians, and they're also products that have been used in cancer patients themselves. And we'll talk more about them, but this box is available if anyone's interested. Okay, next slide. Okay, and we'll progress to Brooke, and Brooke's going to talk about the ingredients. And I had mentioned it earlier as something to pay attention to in the products that you choose. So Brooke?
Thank you so much. I am really honored to be here and to share some information with you guys. I'm going to echo some of what Dr. Singhal talked about, and some of my presentation is very detailed and very specific. I don't want you guys to feel overwhelmed by it. Maybe grab a notebook if you want to take some notes during this whole presentation. As you have already seen, there's a lot to remember. So what I'm going to do is my presentation will be available in kind of a blog form on my website. Even I think later today, I'll put together that. And my website is brookechristinaskin.com. I'll put it in the chat box, and feel free to check it out later. And I just kind of want to start off with a little bit of my, I want to stay on this slide for just a second, but the reason I got into wanting to study oncology aesthetics is because my grandfather actually had leukemia for about 15 years. And he also had skin cancer that was pretty severe. And I wanted to do anything that I could to make him feel more comfortable. So I would get lotions and kind of massage his feet and his arms, and sometimes even do a little bit of makeup on him if he wanted to take pictures with the family, so that he just felt more confident and more himself. And I really got passionate about studying ingredients that could really help him to not only feel better, but look better too. He had a lot of bruising on his arms, and his skin was very fragile. So I started kind of putting together different oils and studying different things that I think could help him. But when I became an esthetician, I heard for the first time specifically about learning about the skin through aesthetics, through special training. And I found Becky and her wonderful workshop education through Oncology Spa Solutions. And I have to tell you guys, it was the best class that I've ever taken. So if you're an esthetician here, I strongly recommend connecting with Becky and just learning about this incredible kind of specialized area of aesthetics. My background is I have a skincare company, and before COVID, I was doing treatments daily and really enjoyed it. So now I'm kind of trying to transition to online, but I also have my Cedesco diploma, which is an international beauty diploma, I guess. And I've learned a lot about ingredients and different machines and massage and things that we can do. So it's always continuing to learn for me. I, am hungry for that. So yeah, that's why I'm here. So we'll start and go to the first slide. One thing that I want to say is just out there on the internet, there's so much information, right? And a lot of times, even for myself, it's difficult to decipher what things to follow, what products to use. And, there's so many people that, even though they're not completely knowledgeable in the area, they decide to share information and opinions, which is fine because that's just part of the nature of the internet. But this panel is here to, kind of just empower you through education. And like Dr. Singhal said, studies are really important in seeing what's actually effective for as far as ingredients to help the skin. And today I'm going to be talking about the skin, but as was mentioned before, I'm totally aware there's many effects on the nails, on the hair, and I think over the next few webinars like this, we'll probably be addressing different facets of that. So I'm echoing again what the doctor just talked about, but healthy skin versus compromised skin. Basically, like she said, the barrier of our skin is disrupted. So we have to be, a lot more gentle with the skin, calming, hydrating. It's super important to kind of switch up your skincare routine when you're going through treatment. And it's not going to be something that will necessarily last forever, 6 months to a year after treatment. The skin is very good at healing itself. But in the meantime, it's really helpful to know what you can do in your skincare routine to help you feel and look better and just be more confident, right? So the skin is just more vulnerable, and we want to make sure that we have that information. Next slide. I'm going to be going over kind of a general approach to looking at ingredients when you're trying to choose your skincare and personal care products. I wanted to highlight that every time you look at a product, similar to food, the first 5 ingredients are really important to pay attention to, because that makes up the majority of what a product actually contains. So whenever I'm looking at skincare, for example, like let's say I go to Whole Foods in the whole body section, I'm picking up a product and I actually count the first 5 and I look at those. It doesn't mean that the rest of the ingredients aren't important, but they're less, they make up less of the product. So stay away from nanoparticles because the skin barrier is compromised. We just want something that is more, it's going to build up the skin barrier, which is the very top layer of the skin, and something that's not as penetrating. Look out for fragrance, hydroquinone, which is a brightening agent, and it's banned in a few different countries. Unfortunately, the US doesn't have many ingredients, cosmetic ingredients that are banned. And I want to make sure that when I'm talking to people, I just educate them on what they need to look out for. Propylene glycol, sodium lauryl sulfate, and parabens. Some of these you might have heard of, and some of these maybe not, but if you could just take some notes that these 5 ingredients are just important to stay away from. They can be endocrine disruptors. So over time and depending on the concentration and the level, the percentage of, you know, what this makes up can be disruptive. Ingredients in all caps: EDTA, PEGs, DEA. These are also ingredients to avoid. And in general, just looking at businesses that focus on like this clean beauty is going to be helpful in choosing your products. What's the deal with parabens? Parabens are preservatives, and there is a lot of information out there. It's one of the ingredients that is banned in the EU and Canada and Asia as well. Like I went over, hydroquinone, it's a brightening agent. It's a known carcinogen, so anything that promotes that, obviously it's not considered a healthy thing. Sodium lauryl sulfate, that's when you use those cleansers or shampoos that really foam up. So just look out for that. There's different ingredients that can create just like a really strong effect, and anything really strong or fragrant, or we just want to stay with really gentle things during this time. Mineral oil, it is a conditioning agent, but there's lots of other great alternatives, such as shea butter is actually pretty absorbent into the skin, believe it or not. You can get just plain shea butter from different like cosmetic websites. If you want to go the organic route, Mountain Rose Herbs is a really beautiful curation of pure like butters and things like that. Next slide. Yeah, I kind of just went over this just now. Not all brands, sorry, can you go back? Not all brands or products that make claims as being clean beauty are necessarily safe. Different department stores might advertise or market things as clean beauty or different brands. So that's why it's important to actually look at the label and not just assume, hey, if it says this, you know, that's what it is. And, you know, some of that is common sense, but I just wanted to mention that. Go ahead and next slide. Deodorant, staying away from aluminum and parabens is important. A lot of the deodorants that you see in the drugstores and things like that, they do have these ingredients. Studies have shown that the underarm area actually absorbs 100% of topical ingredients. So, and then also avoid antiperspirants. So we want to continue to sweat, but obviously make sure that, you know, we smell good too. So just look for really gentle deodorants and just avoid the fragrance, aluminum, and parabens. Next slide. Becky's going to go over a lot of this with you already, but and her line is amazing for these really gentle, cleansing, hydrating ingredients that are going to help try to repair the barrier function of the skin. You know, she pays attention to what's going to be anti-inflammatory, you know, like the hemp seed. Hyaluronic acid is also a great one. Anything that's wound healing is also really great, either for surgeries or radiation. Anything that's antibacterial as well. There's, you know, it's not just like tea tree or different essential oils. They can actually be just botanically derived ingredients. Next slide. And you know, what you received in your box is specially curated for people going through treatment, but also just in general, really hydrating, calming products. Chamomile is very soothing. Peptides are pretty helpful in just smoothing, restoring the skin, firming as well. And then the Serene Elizabeth Essential Spray. I've actually used it myself, and her whole line is wonderful. But I'm glad that you guys got this spray bottle. It's not meant to go directly on the skin, but to kind of spray in the room to help calm. And next slide. Licorice root, natural brightener, and the Color Up eye cream. And Suntegrity has titanium dioxide, castor oil, aloe vera juice. This is actually something I use every single day. I love it, and I sell it on my website. And it's a primer and also a moisturizer. So it's great to wear underneath makeup or just by itself. Next slide. You can find a lot of these products on any one of our websites. Hope and Beauty has a lot of these products. My website, Brooke Christina Skincare, that's brookechristinaskin.com. And then also on Becky's website, her Oncology Spa Solutions. Next slide. And of course, there's other shops that you can look at. I've personally gone into Pharmaca. There's a few in our area in the Silicon Valley, and also, of course, online shops. And next slide. There's a great resource at safecosmetics.org that describes a little bit more of ingredients and kind of the story of how cosmetic ingredients has evolved. I'm kind of an ingredient dork, as you can tell. So I loved this video. And, you know, like I said, I'm just really honored to be here, and I'm looking forward to the Q&A at the very end, so you can ask us all of your own personal questions. I think that's the last slide. And then next, we're going to go into Becky performing a facial using the products in your box. Or if you're interested in purchasing the box afterwards, these are just really great self-care tools.
Thank you, Brooke. Okay, are you guys ready? Wonder if I can get my, let's see here. All right, so we're gonna start, and I don't know why, guys, it's gonna make all of you guys be in the picture too. So maybe you can wash your face while I'm doing it too.
Yes.
So I'm gonna get prepared here. If you guys have the box, go ahead and grab your box, and let's get everything handy so we can do a little facial demo. I'm gonna put my hair up, and then I'm going to put a little headband on so I can get everything out of the way and all ready to do a facial out of a box, right? Ready? I don't think I have a slide for this, so I think we're good. Before we move into that, so here are the items that were in your box. The box is pictured in the middle, and then the products each separately around the side. So you will see you got a cleanser, you got a hyaluronic acid, a skin loving oil, an eye cream, you got the SPF, you've got your little cleansing pads, and also the mask, okay? So what are these products and why are they in there? Brooke kind of alluded to this or shared this in her presentation, but a lot of thought went into putting these products together. And I'll tell you why we did it, because I've done what I've been doing for 10 years, almost 12 with the hospital, but teaching for 10. And during that time frame, people would say, why don't you have your own product? And I used to say, well, because there's plenty of good ones out there. I just had to search hard to find them, but I found them. And we'll let them do their thing. That's their wheelhouse. And my wheelhouse is working with cancer patients. That's my happy place, being able to give them great results with their skin when they're going through this treatment. And about 2 years ago, it came up that, first of all, hospitals said, okay, we like what you're doing, but we need to have a kit. We need to have it available for patients. That, as well as the schools that we're now in, wanted back bar. And they didn't want to buy from 10 or 12 different companies, right? Because that's what we had to do in the beginning. I spent 4 years researching ingredients and products and companies before I brought any of them in to be a mission partner with my training, and found some good ones, but it would be like, this line had a great cleanser, but I couldn't use the other items. And then this one had a great serum, but I couldn't use the other items. So we kind of pieced it together in the beginning. And we now have this beautiful set that can stand on its own. Excellent for people who are going through cancer treatments, but anybody with compromised skin. So it was literally made for the now, I call it, as you're going through cancer treatment. What do you need? Because your skin is different during cancer treatment than it is later on, and different than it was before you started, okay? Because stress and medications all impact our skin. So we put in tons of the good stuff. And you'll see there's apricot kernel oil, rosehip seed oil, hemp seed oil, jojoba oil, frankincense, vitamin E, each ingredient. And I was very blessed to be able to work with a formulator, but each ingredient was picked intentionally. It's in there for a purpose, because what does a cancer patient need? They need things that are anti-inflammatory, protecting, hydrating, full of emollients, like the doctor mentioned in the beginning. We need all of that to really protect the skin, and has all of the good stuff and none of the bad stuff. Okay, so I was really picky, and it took me a while to get to this point, but we finally have a really beautiful, very simple and very affordable kit of products that you can use when you're going through this. So let's go ahead and do our little demo. So I got my hair pulled back. I have my water because I don't have a sink right here. So if you guys are gonna do this with me, we're gonna take our little cleansing pads, we're gonna wet them. And today, because today I have another webinar after this one, I'm gonna leave my eye makeup on, but typically you can use this cleanser as an eye makeup remover also. And I would probably start with that first, just taking off all of the eye makeup first and then wiping it with water. So warm water, not hot, okay? And we're just gonna go around and make sure the skin is wet. That's all I wanna do right now. Then I'm gonna take the cleanser that you have, which is the Gentle face wash, and I just took one little pump. That's all it takes. And we're just gonna massage it around and just lift off anything that's on. Again, it will remove eye makeup. It will remove everything that you need to remove. So you don't have to have a separate one for eyes, okay? And once I feel like I've done a good job of cleansing my face, I'm gonna take those little cleansing pads again and just remove this, whatever's left on my skin. So the cleanser. You realize when you wash your face, you make faces, kind of like when you're putting on your mascara. All right, so I've got all of that off. Now, with my skin still damp, I'm gonna take the Skin Loving oil and I'm gonna put maybe a dropper full. Depends on how much you need, how dry your skin is. So I'm just putting a couple of drops into my hands. I'm warming it a little bit, and now I'm just gonna apply it to my skin everywhere. Remember, this has phytonutrients, which means they're from plants in there that will actually help feed the skin. So our goal is to keep it strong or help it rebuild if it needs a little bit of help. As Brooke said, Our skin is very smart and it knows how to heal itself. We just have to let it do that. And the way we can do that is by not hitting it with any additional toxins during this time, and also putting things on it that will protect it from environment, protect it from UV, blue light, all of those things that can potentially harm our skin during this time, okay? So if we were doing this, we would be doing a nice little massage all over. So this falls into the self-care that the doctor was talking about. And I like to do this. You know, this is funny because I didn't do this on a regular basis because I was so busy prior to this quarantine. And with the quarantine and being at home, I have made it a ritual to do this every week for myself. So I, of course, wash my face every day, but I'm doing a special treatment and really taking additional self-care, which I think is really important. We all need this right now. So with that, we would leave on this oil, and the next step would be to apply the mask. So you got the Belmondo mask. You need to use a scissors to open it because you probably have oil on your fingers and it doesn't open up very well that way. So once we have opened this up, I want you will take it out and you'll see it comes in a little square like that. It's in the middle of two pieces. So you have to take both outside pieces off. Okay, so there's one outside piece. Here's the other side that's out. Now we're going to take our mask that's left in the middle and apply it. I like to start at the top, work around the eyes, pull it on. It's really cool and calming and full of wonderful ingredients that are going to hydrate, moisturize, feed, and just your skin will love it. Now, when you're doing this at home, you're going to leave this on for 20 to 40 minutes. So this is something where you can do some of the yoga things that you're going to learn about later. Or maybe you can do what Brooke did and you're going to read and research a little something if that's relaxing to you. But pick something that is very relaxing that you love to do. Maybe it's binging on The Bachelorette. You know, who knows what your favorite thing to do is when you want to relax. But whatever you do, do that and just leave this on. When the 20 to 40 minutes is up, and I'd leave it 40, okay? Especially the first time. But then we're just going to roll it off like this. And I'm going to take what's left and just massage that in because this is all good stuff. Now, there's a lot on my skin. And when you do this, you will feel this too. So I want to take this down to my neck and décolleté and take whatever's left and put it on the back of your hands. Okay, because this is wonderful. We have skin everywhere. It works everywhere you have skin. Now, when you're done with that, and this is kind of absorbing in, next step we're going to do is we're going to take our hyaluronic acid. So hyaluronic acid, guys, is an ingredient that has the ability to hold 1,000 times its weight in water. So the skin needs to be wet when you apply it, and you're just going to put it on. I just used one pump. It also has marine collagen in it, which is calming and soothing to the skin. And it's going to help with that moisture. So like what the doctor was talking about in the very beginning, how important it is to keep the moisture in the skin, so in the epidermis. And we can do that by using products like this. And then we are going to go over the top of it with our hydrator. So I'm going to take my hydrator and I'm going to put one pump of that. And I'm going to just pat that on. If you need more, you can take more. Rub it all in. My eye cream I'm going to do next. And if it comes in a jar, anything comes in a jar, guys, never put your fingers in it. We don't want cross-contamination. So I'm going to use a little spatula and I'm going to take out just a tiny little bit. I don't know if you can see that, but it's a tiny little bit. I'm going to put that on my ring finger, and the proper way to apply an eye cream is to pat it along the ocular bone, top and bottom. So I'm patting it in like that. If I need to now, I can do a little soft sweeping Don't want to do anything heavy or hard-handed around the eyes, okay? Our final step is to take our SPF, especially if we're going to go out, but this SPF, guys, just FYI, has the ability to block blue light, which happens from our computers and our televisions these days. And they're doing some studies on this. I think we'll see more coming up, but we need to protect ourselves from that as well. So you could wear this every day, like Brooke said, okay? So it's a primer, and it's a moisturizer, and it's SPF with zinc. So watch when I do this, you'll be able to see the white, right? That's zinc. That means that the particles are not nano. They are not so small that they will enter the skin and the bloodstream. It's really important. We don't want that. So that means when you're choosing an SPF and it says it has zinc in it, you need to see some white. If you don't see some white, then the particles are too small and they won't sit on the surface of your skin and protect you from that UV. They'll actually be able to go in, and we don't want that, okay? So once I've done this and I've blended all of that in, I am ready to go. So I hope you did it with me, and if not, you can watch this later and follow along. Enjoy your products, and again, thank you guys so much for being here. I said this earlier, but this truly is my happy place, and I've been able to get back into the hospital just about 2 weeks ago and be able to be there and really help and work with the patients, and it's so wonderful. So thank you for joining us today, and we're going to move on to the next section, which is Miss Julie. Julie, are you unmuted?
Not unmuted, so now I am. Let me get my screen. There we go. Okay, so go ahead, take a moment to just take your headband off, move your products to the side, just get a little situated for a moment since we're going from an active exercise. Okay. All right. So what I'd like to talk about, could you put the slide on for the app picture real quick, Becky? Is it there, or am I just seeing you?
Are you not seeing it?
I'm not. Is anyone else seeing it? Okay. So for whatever reason I can't, but the first slide here, we have created, again, my charity is called Wellness for Cancer, and we have worked with cancer patients, cancer thrivers, the spa industry on how to bring breath work, meditation, yoga, mindfulness, and self-care to individuals who have been touched by cancer, to caregivers, and also we run many mindfulness workshops with oncology nurses as well. And what we have found during COVID is a lot of people are learning to take better care of themselves. And that's the reason for this workshop, right? But we also have to go in. And so the slide that's up right now is Kaleidoscope View, which is an app and a web portal that we are launching in the next 2 weeks with a survey. So if you are someone who has been touched by cancer, please email me. You'll see my email at the end, and we can give you access. The only thing we ask is that you do fill out the surveys, because we would really like to take this out broader globally, and also to be able to tailor more to individuals' needs. So it's really important for us to get feedback on that. What I thought I would start with today is first a little movement. Even though we've been cleansing our face right now with some movement, we have been sitting, or at least I've been sitting, close to an hour. So it's important to start moving a little bit. And even if you are in a bed right now, let's say, watching this, you can still move your body. So let's just start with moving our shoulders. So we're going to take our shoulders up, we're going to bring them back, and we're going to bring them down. Okay, so coming up and back and down, up and back and down. 2 more. Becky, you're smiling so big right now. All right, and reverse directions. And some of you did have your hands up here, and that's fine. You can do that. 2 more. Okay, nice. All right, a lot of us, we sit all day in our chair and maybe for the last hour. So what I'd like for you to do is to bring your hands, you can almost sit on your hands, all right, and bring your shoulders back, bring your chest forward and look up, all right? Not all the way up to the ceiling, but just kind of up a little higher than your eyes. And I just want you to close your eyes for a moment. Allowing your chest to open up. Bring a smile to your face. And I just want you to breathe for a moment. Being grateful for this moment together, to have some fun together. Okay, and now you can bring your hands back to your lap. The one other area I'd like us to move together is to cross your leg. I'm wearing my socks. My house is 62 degrees and I'm cold, so I have socks on. So you're just crossing your leg over, and you're just going to bring your knee up a little bit, and then you're going to gently push it down. And what we're doing is we're stretching our hips because we've been sitting for a while, right? So this is really important because many of us are on Zoom calls. You don't have to go very fast, you know, just to open up those hips. And we'll do the other side. Crossing your leg. Then just bringing your knee up and pushing it gently down. Coming back up. Pushing back down, doing it 2 more times. Good. Okay. One of the things when we talk about lifestyle and self-care is, again, we're spending a lot of time on Zoom. Or watching TV at Netflix too. It's the same thing, but we're spending a lot of time sitting, and sitting is called the new smoking. So it's very, very important that every 90 minutes at most, you get up and you move, or you move your shoulders, you move your neck, because most of us are sitting like this, right? So that's not good for the curve in our neck, and it's not good for our shoulders, creating that hump. We don't want to look like this, right? So we want to learn to come back here and making sure that you're also stretching your neck. So when you do your neck, you just come down a little bit. I'm not going to worry about the breath right now. Coming center and moving slowly. If at all it feels like it hurts, then you've pushed it a little bit too far. So that's why we start just very slowly. Coming back and coming center. All right, now you're going to look over to your right, which on the screen will look left. Coming center, left, coming center. One more, right and center, and left and center. When you do these gentle stretches, there's a few ways that you can do it. Some of you may be doing it as exercise. Okay, I'm going to move really fast through it, right? And some of you may be doing it with your breath to just experience coming out of your head and coming into the body, which is what we'd like to do. So we want to slow things down, and we want to learn to move with our breath so that we become more present. Again, because we're interacting so much with our PCs that we're not present. We're really in our head. And the invitation is to come back into this beautiful, magnificent body that we're learning to take care of. So even if you do these, you know, the shoulders, the neck, and the hips, you can even add the ankles in every morning. Do it in your bed before you even get out of bed. It will really help you. Also do it a few times during the day if you're sitting and you're not able to get up and go for a walk or do any form of exercise. And it's also important to do before you go to bed. Now, the more that you come here relaxed, you may notice that my voice is very calm, right? So the more that you work with your breath, the more that you move slowly and come into your body, the more present you will be. And for me, as a speaker, how do I know? Because my voice is here. If my voice is up here, I know I'm typically not very present, right? I'm in my head at that point. So the invitation is to not just think of yoga as a movement or even the stretches as a movement, but it's a way of coming back into our bodies. We take our bodies for granted. We don't think about breathing. Our body doesn't need us to tell it how to breathe. It knows what to do. But many times, our body is giving us signals of where our mind is. So this is partly mindfulness that I just wanted to share. There is a relationship between the mind and the body. And coming home, coming into the body, helps us to understand where our mind is. So if our heart is racing, maybe that's anxiety, and we feel it in the body, and that's telling us something's going on. Maybe we have discomfort in the body somewhere. Maybe we feel guilt or shame for not being as beautiful as we once were, or unworthiness, or maybe we even feel joy, right? All of this can be felt in the body. So when we do a lot of mindfulness practices, whether it's yoga, whether it's breathing, whether it's a body scan or anything like that, we use the breath and the body to tell us where we are, because our mind is all over the place. So our mind doesn't always tell us where we are, but the body follows thought. The body doesn't know what's real. It doesn't know that there isn't a tiger in this room, but my mind is imagining something very bad, something very threatening. So my heart starts to race. My palms start to sweat, but my body doesn't know. It's just following where my mind goes. And when we go through cancer, and when we go through survivorship, and we have our, yearly exams or anything like that, our body could be racing, right? And maybe we know why, and maybe we don't. But coming back to the breath or coming to simple movements helps to calm that body down. And the last part I just want to say in this lecture piece, and then we'll just do a nice breathing, is the mind is not just in the head. The mind is throughout the entire body. And so the invitation when we talk about mindfulness, again, meditation, yoga, breath work, is to learn the relationship between the two, so you can live a more well life, so you can allow difficult emotions to be here, but to not judge them, to not try and push them away, but to create space. And that's what the app is for. And we have a workbook that will go with it, so that you can develop some of these home practices on your own, because there may not be an app or Wi-Fi service when you're encountering a situation. So the idea is for you to learn to develop practices that work for you. What worked for me may be different than what works for Becky. So it's important, honestly, to begin to practice, not just watch, like zooming around on Netflix and just watching a yoga class or watching a meditation, but actually practicing is the most important. And even if it's just doing the rolls and the neck and doing it a little differently every day, maybe one day doing it with your breath, maybe one day doing it with your eyes closed, then you begin to develop a practice versus check the box, I did this. Okay, so let's just take a breathing exercise for a moment, and let's just sit up as tall as possible if we can. And just noticing the chair that's supporting your sits bones. Noticing the floor that's supporting your feet. You can keep your eyes open or closed, but know that you are completely supported. And come to your heart, the center of your heart. Just breathe in for a count of 5 into your heart. Breathing out for a count of 5 through your heart. Breathing in. Breathing out. One more breath. Breathing in for a count of 5. Breathing out for a count of 5. Now do me a big favor and smile this time while you breathe in for a count of 5 and out for a count of 5. Keep that smile on your face. Now I want you to just explore and notice if your breath in your body feels different from just a smile. It's the only thing you changed. You smiled. Breathing in for a count of 5. Breathing out for a count of 5. Go ahead and slowly open your eyes. Beautiful. So this is called heart math. It's also called heart-focused breathing. And the idea is that your breath can calm your body. When your body's calm, your mind is calm. And the reason that I do this in short practices is so that when you're in the difficult moment with your teenager yelling at you, you're at the doctor's office and you feel your palms sweating, right? Or whatever that situation is, you go to your breath and you just breathe in for a count of 5 and out for a count of 5. The more that you do this, the more that your body wants this, because this is your natural state. The rest is not your natural state. So the more you come here, the more joyful, the more relaxed, the more calm you'll be. You know how to breathe. You've been breathing your whole entire life. You've got this. You're one breath away. So please email me if you'd like access to the app. I will go through the onboarding process with you. I just ask that you do fill out the surveys for us so that we can help so many people around the globe. Back to you, Becky.
I think we're back to the doctor. And let's see where we're at here. Thank you, Julie. That was fantastic. I know I needed that this morning.
Yeah, that was amazing. So I think that you've heard from everyone, and we listed a slide here for our contact information, and we have a couple things from Hope and Beauty, which you can email us. You can join our My Cancer Story. You can visit us on Shop Hope and Beauty. And then Brooke and Becky and Julie, why don't you start with Becky about your contact information and how you'd like to be contacted?
Great. So my email address is here. And I am open to you emailing me with any questions that you have as you're going through this journey. If you have a question about your hair or your nails or your skin, anything in that realm that I can help you with, it's Becky at oncologyspasolutions.com. And I look forward to hearing from you. Brooke, you want to tell them yours?
Sorry. Yeah, so email me at contact@brookechristinaskin.com. You can also go to my website at brookechristinaskin.com. And I also have an Instagram where I post kind of some wellness and skincare tips. And that's at Brooke Christina Skincare. Feel free, like Becky said, to email me and ask me any questions as well. I have some oncology safe products on my website as well, with a brand called Hale and Hush. And, you know, if you, I also have, you can schedule a complimentary virtual consult with me. So we can also see each other over Zoom. And yeah, I think that's it.
Okay, Julie.
So my contact is Julie at wellnessforcancer.com. And I think I've already spoken quite a bit. I want to thank all the participants because you have all stayed the entire time, which is beautiful for all of us to see. So thank you for your attention and your interactivity.
Perfect. So I'm going to open this up to questions. And while everyone's getting their questions together, I'm going to ask the panelists a question. So, you know, because my patients come back to me and they have very specific issues that they're dealing with. But what I've heard over and over again is that from the patients is, oh, I don't want to bother the doctor with this little thing. So what is the little thing that everyone's talking about, Becky, that they don't want to bother the doctor with?
I love that. It's such a great question because I remember in the beginning being in a cancer center, which is where I have a location, and having these patients come in to see me about a skin condition. And I always ask them, did you share this with your doctor or your medical team? And they would always go, oh, no, should I? Or I don't want to bother them with that. It would be anything from, why is my skin rashing? Why is my skin red? Why am I losing my hair? A lot of things that, and then it was funny because when they'd say, well, I didn't know I was going to lose my hair. I remember going back to the nurse navigator or the doctor and saying, did you tell this person they would lose their hair? Yes. So it's a lot of information, you know, when somebody gets diagnosed with cancer and they don't always take it all in. So if you are an oncology trained esthetician or somebody who's working with cancer patients, you're going to get a lot of these questions of things like this that always make sure you're referring them back to their doctor so that their doctor knows about it as well. But it could be anything from hair loss to rashes to dry skin. My nails are doing this. My veins are turning black. Why are these spots showing up on my face? So it's good to have this knowledge so that we can help really answer these questions and then refer them back to our doctor.
And from my own perspective, is I think that the patients, I've talked to patients for an hour and they're so fearful of what I'm going to say that they don't remember what I'm going to say. And so then immediately they'll go and ask the nurse or whoever was in the room, well, what'd she say? What was I supposed to do? And I think the complementary team of having everyone who surrounds the cancer patient helps a lot, because then, you know, if they're not comfortable speaking to me about whatever thing it is, then at least there's a safe place for them to ask their question. Right. And to have a knowledgeable person there that will help them through whatever question or direct them to the right place, which I think is cool. You know, the physician has limited time to talk to people, and usually it's about something tremendous and scans and this and that and the other thing. And so having these other resources around, I think is critical for the well-being of patients. So Brooke, anybody ask you anything that surprised you? Or
can you hear me?
Yeah.
Okay. I actually do microblading. So what microblading is basically a cosmetic tattoo for your eyebrow area. And I have some of my clients asking me, can I do this right now during treatment? And of course, my answer is we always need approval from your doctor first, but also my personal professional opinion is let's wait until 6 months to a year afterwards where your skin is not as compromised, because we don't want to do anything to harm the skin further. And also I get a lot of questions about brightening and hyperpigmentation and sunspots that they see, like Becky and Dr. Singhal have mentioned, and what can I do? And sometimes I can use some extremely gentle enzymes to exfoliate the skin. It's not for everyone, but depending on how your skin is reacting to chemo or radiation, we can do that. But mostly things like microdermabrasion, where it's more, it's like a stronger type of exfoliation. We want to wait until your skin, like I said, has recovered a little bit more. And in the meantime, it's all about that protecting the skin, calming the skin, hydrating the skin so that it can heal, and that we can do those things faster.
Great. And Julie?
What I have been asked a lot about is acne. When people have different kinds of acne from maybe they're on different kinds of inhibitors, the EGFR inhibitors and things like that. And to know that when you're in treatment, you do not want to be using any acne products. The reason for the acne is because of inflammation. That particular pathway, if somebody's using an EGFR inhibitor, and I'm sure Becky can give the technical names for some of them, or the doctor can, is because that is a pathway that the cancer might be growing. But it's also the same pathway that grows healthy cells. So the reason that it looks like acne is because the skin is highly inflamed and sensitive. And so a lot of times clients will come to me and say, can you do an acne facial? I've been doing a spot treatment and things like that. So the one big no-no while you're going through treatment is to not use any acne products or anything that's going to dry out your skin. But also it's important to not only let your esthetician know, but to also let your doctor know if you're having any kind of acne or what looks like acne on your face. It is very important for them to get that under control if they need to give you any type of topical or internal antibiotic to prevent it from getting worse.
Okay, so I have another question for you guys. There's a bunch of patients who embrace the cancer diagnosis, and then they wear their shirts and their ribbons and this and that. And then there's a whole bunch of people who don't. So what has been your experience? Do people want to be called cancer patients and cancer survivors, or do they not?
Super individual. Just like each of us are individual and what we will identify with when we go through something like this. And I've definitely seen both sides almost equally. So again, when you start meeting with somebody and you find out what their side or their perspective is on their diagnosis, it will help guide us as trained professionals to know how to move forward, because some of them don't want to be called a survivor. Some of them won't wear pink. Some of them don't want to identify with the ribbons or anything else. And so we need to be aware of that so that when we are interacting with them, we can kind of mirror what they're looking for and help guide them in a way that is safe and feels comfortable to them to do that. But you're right, there's definitely all across the board when it comes to wearing the pink or not wearing the pink, or wearing the hat or not wearing it.
I mean, I would say what I've always said is that we want to recognize a person for the being that they are, and to never define a person by a diagnosis. And if you think of the statistics, 1 in 2 men, 1 in 3 women will have cancer through their lifetime. You can't just start calling everybody, a cancer patient, a cancer survivor, and also you do not have cancer skin. Cancer is not a skin type either. So you do not have to define who you are, your wellness options, your skincare options by the term cancer. And it's really empowering. Some people like Becky said, to identify that way. And a majority of my clients do not. So it is personal choice, but know that even down to your skincare does not have to be defined by a cancer diagnosis. It's defined by the conditions that the doctor was talking about. Xerosis, dry skin, that's a skin condition. That's not a skin condition just for cancer. So if anything, for you to take out of this hope and beauty, it is important to also understand that you do not have to define it that way. However, with your esthetician, you need to be forthcoming as to if you're on any medications and if you're seeing a doctor. This is something we don't want you to hide, right? We want you to let us know if you are going through cancer treatment and things like that, because that can affect your skin.
I just want to say something. I haven't gone through cancer personally, and I have to say and admit, I'm still learning myself how to approach it, what people are comfortable with. So if you go to somebody who is oncology trained and you hear them say something that you don't like, it's important to speak up and say what you're comfortable with and feel empowered in that way. I try to be extremely sensitive and respect, like Julie said, that this diagnosis does not define you. But I continue to learn and try to be humble in approaching people that are dealing with this. So we have a few questions in our panel, in our chat box.
Add something to that since we're right there. Is
Sure.
super important for people who are oncology trained, or if you're going to be working with this client demographic, that you just treat them like a regular person. So it kind of goes right in line with what everybody's been saying. We aren't talking about a cancer in a person. We're talking about a person first who is going through cancer. So when you can treat them like a real person and really listen to somebody, it makes all the difference in the world to them, because that's really what they're looking for. They want to be heard and they want to be helped, but they want to be looked at as an individual and as a person first, cancer later.
Thank you, Becky. I appreciate that.
Okay, the questions in the chat. Brooke, do you want to repeat the questions?
Sure. So first of all, Anne's, I want to pronounce her name right, Anne too, says, many times I want to ask Dr. Singhal for permission to record our conversation, because by the time I got home, I forgot half of what she said. I don't want to be called the C girl, but it's hard sometimes because sometimes people are harsh, which, you know, it's definitely kind of for Dr. Singhal to answer that.
Yeah, so I have no problem having people record what I'm saying. I have no problem people call their friends while they're here. All this, I mean, there's been roomfuls of people here and asking their questions and things like that, because, you know, when you get the diagnosis, it's kind of a life moment, right? It's where you have to change how you think about things. You change how you think about yourself and what your goals are, what you're this, that, the other thing. And so I'm more than happy to have people participate in that. I think that there's a number of people that it's difficult when you want information and you want to be an educated patient. Sometimes it's hard because the information I'm trying to give you takes a while to understand. And so you might have to hear it 2 or 3 times. And so, no, I know on that we've had lots of conversations about different things, but it's, you know, I don't know, if you came to me and you said, listen, Dr. Single, you really need to learn about finance, and you really need, I'd probably have to hear it several times before I figured it out. And so when it's something so important to your life and to going forward, it takes a few times to understand. And you should feel comfortable that you can ask your question. And the other issue is also particularly critical, right? There are some people who sort of embrace the community, as I said, of cancer patients, and they do the walks, they do the this, and there are other people who really are fearful of that C word. And, you know, in my experience over the last 15, 20 years, and I think everyone would say the same, is that I think we've gotten better. I mean, I really think that we've gotten better at treating people. So what I've said to people, which they get very kind of mad about, is that I don't think cancer is going to turn out to be the disease that kills you. It's going to be a disease that you deal with over time, but everybody wants it gone. They want it there and gone. And unfortunately, it's not turning out to be like that, but so I feel like the severity is not as bad as it used to be, because we have so many more medicines, so many more treatments. And so I'm kind of excited that we may get ahead of this.
I love that. And I'm so glad that she asked that, because I have people ask me that all the time. Would it be okay to record that? Because there's so much information with that diagnosis that the minute you hear that you do have cancer, I think the ears shut off. And you're like, that's all, you're stuck right there. That's all you heard. So that's fabulous. And I also like the point that you just made about, if something's not going right with your appointment, whether it be the doctor or a spa professional, speak up, because we do want to help, and we do need to know what you're going through, or what works or what doesn't work, so that we can fine tune all of that. And I love that you said, you know, they had to say it many times to you about finances before you went and started, you know, doing some research. And they probably did the same thing for the skin. And look where you are now, and how much help, you know, more helpful you are to your patients. So, and that was because a few people kept asking you about it. So keep it up.
You know, I'm going to tell you, the first person who talked to me about it, and I have to say, I just didn't see it that way. And, you know, the patients teach you as much as you teach the patients, right? And this older woman, who by no means is she a fashion statement at all, and she comes in here, she had a breast cancer 25 years ago, and she had a recurrence, and we had to do a mastectomy, and she was talking about remodeling her bathroom. And she was saying how she doesn't like to get out of the shower because she doesn't like to see herself, and she feels that she'd been maimed in this whole process of treating her. And so she remodeled her bathroom so she could get out of the shower without being able to see herself in the mirror. And how she doesn't wear t-shirts that are a certain size, and how she feels that she has to stay in her house and she can't go out much because of all these things that have happened to her. And I was of the completely opposite perspective. It's like, oh my God, you had breast cancer 25 years ago, and look how well we did. You're still alive 25 years later. But it didn't really realize the impact of the treatments that she had, how much it changed her life. And then I started asking people, and, you know, it's a education to ask people what treatment actually does to them in lots of different ways. And, you know, you can really learn a lot from patients, and you can learn a lot from people that have been through these experiences if you just take the time to listen. And that's what I would encourage everybody, is to listen, and not just, it's hard to listen to people's stories sometimes because they're sad, but it's important. And I think people get a lot of value, and you can really learn. Like this particular lady taught me a lot about asking one more question to people.
I love that.
Any other questions from the chat box, Brooke?
We have Trish, and Julie answered this a little bit in the chat box, but Trish says some clients don't like changing their products all at once. Do you recommend, if they have a product free from toxins, to combine products short term in the transition to new products?
I say yes, because it's super important. They've got multiple medications, stress. You don't want to be changing up a lot of things right now. So if their products are already good and clean, yes, they can use them and then move forward until they don't work. If they don't work, then they can come back and try something else. Good question.
And yeah, I would say just pay attention to if those products that you use are kind of harsh and majorly exfoliating, even if they are clean. Just make sure that it's pretty gentle. And then as you are more comfortable with kind of switching up your products, then do that. But yeah, I mean, I think as long as they're not too harsh, then that would be a kind of benchmark for.
I use
What do
a
you think,
question.
Becky?
I ask them this: is it effective? Right. So is it working the way you want it to? And how does your skin feel? How does your skin feel? If your skin feels moist and hydrated and comfortable, you're good. If, as Brooke says, it's exfoliating too much or it starts feeling tender or sensitive, that's not a product you should be using right now.
Right. Julie, do you have any feedback on that, or Dr. Singal?
No, I just answered it in the chat. That's, I believe an esthetician should look at it, or somebody even over the phone, to see if there's anything too active in it, because how your skin may be before treatment, obviously during treatment, can be different, and different from your friend who may be having the same medications and the same cancer. So it's important for someone just to look, just to see, maybe your product has retinol in it. Maybe it's an anti-aging product, and that's, you feel like it's calm because you've been using it for a few years, so you don't notice certain things. So it's just important for someone just to look at those initial ingredients to make sure. And also, if the products are old, or if you stuck your fingers in them, then we would definitely want to switch you to something because it's either too old, or because perhaps it's been cross-contaminated. And as the doctor talked about, the barrier is disrupted, right? So pathogens can get in. So there would be reasons why you would want someone to at least discuss with you the products that you're using.
I was going to say, oh, sorry, go ahead.
Well, the thing that I was going to say about lots of patients is they feel like there's these overwhelming things, right? There's the diagnosis, there's the scan, there's all these stuff. And that maybe it's too much of it. You know, a lot of patients have said to me, well, I'm lucky to be alive, so I guess it's okay that my skin is red, and I guess it's okay that this is that. But actually, it's not something that you should not pay attention to, I guess is what I would say about it. And with this idea that this turning inward and looking at your face and looking at how you look and how you reflect yourself, that's towards your quality of life and your mental health as well. So it's an important piece of the treatment, is to monitor what you feel. Go ahead, Brooke.
I was just going to say to any estheticians on here, or even you know, people that want advice on their products during this time where you might not want to go to an esthetician, or where your county is, it isn't allowed. For my clients, I say, oh, why don't you send me a picture of the ingredients on the back if you're really, you know, wanting to know, or we can even schedule a consult and kind of go over your concerns. But I think that's another option.
Great. Well, anybody else have any questions or any thoughts? So we have a couple of kind of housekeeping things. We're going to come back on February 6th to do another webinar, and we haven't decided, to be fair. We're going to do something related to side effects, but I'm not sure if we're going to do skincare or nails or hair. We'll have to work on that, because, you know, we got so many questions that people have asked, and we're trying to collect which ones would be of interest to people. And so, but it'll be February 6th for sure. And then the other thing is that there's lots of resources. You have our contact information, and we're happy to answer questions, happy to work with you. There's the wellness box, which has all the products in it, is available if anybody feels inspired to try it out. 4 full-size products, and one of the things that we didn't talk about too much, which I think is an important piece of self-care, is friends and family always want to do something for you, right? And having them participate in this wellness and self-care and making sure that you're feeling good, I think is important, and just to keep that in mind. Any last thoughts from anybody? And I feel like there's one question. We'll call you offline and get you some more face masks. How's that?
Yay, somebody needed more. I love it. Thank you everybody for being here. I think it was great. You do have our emails, so if you have any last minute questions afterwards, please reach out. Okay. Thank
Okay.
you.
Well,
Thank
thank
you,
you guys.
everyone.
Have a lovely day, and we will see you February 6th.
Okay.